To those who carried out this attack, as well as anyone who wishes America harm, know this: we will not forgive. We will not forget. We will hunt you down and make you pay.
All right, first at 5 o'clock, President Biden vowing for justice following a terrorist attack in Afghanistan. Suicide bombers and gunmen targeted crowds near Kabul, near the airport, killing at least 73 people, including 13 U.S. service members.
Despite the attack, U.S. officials say the evacuation of Americans and others will not stop, and that flights are continuing at the airport. NBC's Tracy Potts has been following the developments from Washington, D.C.
Chaos in Afghanistan's capital today after what the Pentagon calls a complex and heinous attack. President Biden addressing suicide bombers and gunfire at two sites near the Kabul airport that killed 11 Marines and a Navy medic and wounded 15 U.S. service members.
These American service members who gave their lives, they were heroes. Heroes who've been engaged in a dangerous, selfless mission to save the lives of others.
60 Afghans were also killed. The president admitting the effort to get Americans and Afghan allies out in the next 5 days, now even more dangerous.
We will not be deterred by terrorists. We will not let them stop our mission. We will continue the evacuation.
ISIS-K terrorists, rivals to the ruling Taliban, claimed responsibility.
To those who carried out this attack, we will not forget. We will hunt you down and make you pay.
As more Afghan refugees arrive in Europe and Washington, options are waning to safely extract up to 1,000 Americans left. The latest violence fuels growing skepticism that the U.S. can exit by August 31st.
We cannot leave a single American that wants to leave in Afghanistan, so I would extend as long as necessary.
Tear gas used to clear crowds before today's explosions. Crowds of Americans and Afghan citizens desperately trying to escape. Tracy Potts, NBC News.
And NBC News will have a lot more on these developments in Afghanistan as more information comes in. You can look for continued coverage of the attack beginning at 5:30 here on KGW.
And here at home in the pandemic, reinforcements are on the way to help with Oregon's stressed hospital system. Some may arrive as soon as this weekend. Pat Doris explains.
At St. Charles Medical Center in Bend, help from outside the state cannot arrive too soon. The hospital has job openings for many nurses who are badly needed. Dr. Doug Merrill, the system chief medical officer for St. Charles, told me last week in Bend that it's difficult to hire nurses right now.
We have 161, I think, nursing positions open and unfilled right now at this hospital. Right.
The lack of workers means those who are here work longer and more frequently, and sometimes hospital beds are simply not available because there's no one to take care of the patient who would be put in that bed. But that may soon change, at least in the short term. The state of Oregon hired 2 companies to supply nurses and others for Central and Southern Oregon hospitals and long-term care facilities. Dan Dietrich is president of Jogan Health Solutions, which is sending up to 500 people. How long is it going to take these teams to get here?
Yeah, so we move really fast, and we will have them in place within a few days.
Really?
Yes.
So, like by the weekend?
That's what we specialize in, rapid deployment in response to these types of emergencies.
He said his teams are made up of professionals from outside Oregon, so it's not taking from the very areas which need help. Hospitals began asking the state for extra staffing 2 weeks ago, according to the OHA. St. Charles Bend and St. Charles Redmond have asked for a total of 58 acute care nurses, 76 critical care nurses, 9 emergency department nurses, 5 respiratory therapists, and 46 certified nursing assistants. The system CEO said he's relieved to hear that help is on the way. The chief financial officer for the Oregon Health Authority said Oregon has already done work with Jogan Health Solutions, but this contract will be much bigger than before.
We had already done some work and so had a contract in place that we amended. It's for a lot more than what we originally had originally set up with them. It was $1 million contract. And now, as you saw, it's $100 million.
Those healthcare workers now on their way to Central and Southern Oregon could be here for some time. The extended contract runs until the end of the year. In Northeast Portland, Pat Doris, KGW News.
COVID hospitalizations continue to climb in Oregon. Let's take a quick look at the numbers. Health officials report that Oregon has 1,085 COVID patients in hospitals right now. That's an increase of 5 since yesterday, and a massive increase compared to where we were when things got to where we were at the start of July. You can see that reflected in the sharp spike on this graph. 299 of these patients are in the ICU.
New COVID projections in Oregon are painting a rather grim picture. Based on current trends, OHSU predicts by Labor Day weekend the state will be short between 400 and 500 staffed hospital beds. Some of the worst hit places are Jackson and Josephine counties in southern Oregon. The COVID rates aren't just among the worst in the state, but the entire country. Our sister station in Medford spoke with OHSU's lead data analyst about the projections.
It is burning like a wildfire in Region 5. If you are unvaccinated, there's a very good chance you're going to get infected soon. I did produce a separate forecast just for your region because I was seeing that the numbers were almost unbelievably high. And because of that, I did a forecast, and indeed it's followed that path almost straight up. I think you're up over 200 people in the hospital now. And so unfortunately, that track is held.
Dr. Graven says hospitalizations in that part of Oregon are statistically 3 to 4 times worse than anywhere else in the state. Nurses continue their calls for people to get vaccinated.
The ages of people that I put in body bags in the last couple of weeks are 20, 37, 42, 45, 52. I've seen a lot of people die. It's a lot easier to trust me and trust us medical professionals and get a vaccine than it is to trust me when I'm about to push a plastic tube down your throat, put you on a breathing machine.
Okay, that's pretty horrifying. OHSU is working on a new COVID forecast set to be available by the end of the week.
That frustration is being felt, as you can tell, by hospital workers across the state, and we're seeing it firsthand. Our reporters went inside the ICUs at 2 Oregon hospitals to see just how bad the situation is. You can watch our full coverage tonight at 6:30 in a special KGW newscast called Overwhelmed Inside Oregon's ICUs. Meantime, health officials are also having to reiterate, do not take cattle dewormer to try and fight COVID. Misinformation surrounding ivermectin has spread to the point that even the drug's own maker has had to issue a new statement. Here's Kristen Severance with tonight's Verify.
We continue to get emails from viewers about ivermectin, like this one from Joanne. So she wrote us saying there is good evidence that ivermectin really is effective for COVID-19, even though the FDA and CDC are bent on selling the vaccine as the only answer. Now, we've done a lot of research on this, and this is just not true. That's according to the Federal Drug Administration, Centers for Disease Control, the World Health Organization, Oregon Health and Science University, and the manufacturer of ivermectin, Merck. They all say that ivermectin should not be taken to treat COVID. Ivermectin is a drug meant to prevent parasites in animals like horses. Ivermectin tablets are approved at very specific doses for people for treating parasitic worms or in a topical form for head lice. The FDA said taking large doses of this drug is dangerous and can cause serious harm. The Oregon Poison Center at OHSU has received 9 calls this month about people intentionally misusing ivermectin. Compare that to only 3 cases of people misusing the drug in all of 2020. Now, several viewers have sent us links to studies like this one, studies and clinical trials as proof that ivermectin works. But again, that's just not true, and here's why. Merck, the manufacturer of ivermectin, said there is no scientific basis for a potential therapeutic effect against COVID-19 from preclinical studies. Merck also said there is, quote, a concerning lack of safety data in the majority of studies. Again, this is coming from Merck, the company that makes the drug. Then there is more information from the National Institute of Health, or NIH. NIH said the studies of trials of ivermectin when it comes to COVID were lacking in terms of information, scope, and methodology. NIH said there is insufficient evidence to make a recommendation on the drug. They also said that lab research shows that ivermectin may kill viruses in a test tube, but no clinical trials have reported a benefit for human patients with those viruses. I talked to Dr. Marcel Kerlin about this. He's an associate professor of medicine in the Division of Infectious Diseases at OHSU. He's also the medical director for occupational health. He said just because something works in a lab does not mean it will work in the real world.
If you have cells on a Petri dish and you put a lot of ivermectin on there, it kind of inhibits the virus. And that made people think, well, let's use it for COVID. The problem with ivermectin is those studies, those laboratory studies, use doses that are orders of magnitude higher than what you and I would get for a parasitic disease. So the problem is you run into toxicity. I believe that is going to be an obstacle, that the doses just required is just too high, would be toxic or fatal for people. And so it may not be clinically useful, even if it works in the lab.
So again, based on guidance from the FDA, CDC, WHO, OHSU, and Merck, ivermectin is just not an effective treatment for COVID-19. Do you have something you want us to verify? Let us know. All you have to do is send us an email using verify@kgw.com.